Why do H. pylori symptoms persist after treatment? Imagine battling an infection that hides in your stomach lining, causing discomfort and health risks. Even after completing treatment, some people still feel symptoms. So, why does this happen? The main reason is that the bacteria called Helicobacter pylori may not be fully gone. Sometimes the antibiotics used to kill it aren't strong enough or don't work because the bacteria have become resistant to certain medicines. Resistance is when bacteria adapt and no longer respond to antibiotics like clarithromycin or metronidazole, making treatment less effective. If the bacteria aren't completely eradicated, symptoms like stomach pain, nausea, or indigestion can continue. Another common factor is that people might not follow the treatment plan exactly. The medication often needs to be taken for at least 10 days to 2 weeks, and missing doses or stopping early can leave some bacteria alive. Side effects from the medicines, the cost of treatment, or simply not understanding the importance of completing the course can all lead to poor adherence. When treatment isn't fully followed, the bacteria can survive and cause ongoing symptoms. High stomach acid levels can also interfere with treatment. Acid can make it harder for antibiotics to reach and kill the bacteria effectively. If the bacterial load is very high, standard treatments might not be enough to clear the infection completely. After successful treatment, reinfection can happen, especially if you are in an environment with poor hygiene or close contact with someone who is infected. Reinfection means the bacteria come back, and symptoms can reappear. Even if the bacteria are gone, some people continue to experience symptoms because of lingering damage. H. pylori can cause gastritis, ulcers, or other changes in the stomach lining that take time to heal. Sometimes, symptoms are caused by other conditions that were present before treatment, such as gastric ulcers or precancerous changes, which need further investigation. Additionally, genetic differences in how individuals process medications can affect how well drugs work. For example, some people metabolize proton pump inhibitors, which are used to reduce stomach acid, less effectively, reducing the overall success of treatment. Lifestyle factors like smoking can also play a role. Smoking can increase the risk of treatment failure by affecting the stomach environment and immune response. To address persistent symptoms, doctors usually recommend testing to confirm if the bacteria are still present. This is often done with a urea breath test or stool antigen test at least for weeks after treatment ends. If the infection persists, doctors might suggest trying different antibiotics based on resistance patterns. In some cases, an endoscopy with biopsy may be necessary to check for resistance or other issues like gastric cancer. From a stomach cancer prevention perspective, persistent H. pylori infection is a concern because ongoing infection keeps the stomach inflamed and damaged, which can lead to more serious conditions over time. Proper follow-up, testing, and tailored treatment are essential to ensure the bacteria are fully gone. If symptoms continue despite treatment, consulting a healthcare professional is crucial. They can help determine whether the infection has been eradicated or if other stomach issues are involved. Remember, each person's situation is unique, and personalized medical advice is always the best course. Addressing persistent symptoms early helps reduce the risk of complications like stomach cancer and promotes better long-term health.